Good afternoon, Berkeley. Thank you for joining us for this virtual town hall with our City of Berkeley's Health Officer, Dr. Lisa Hernandez, and our City Manager, D. Williams-Ridley. And we're very happy to be joined today by our State Senator, Nancy Skinner, who will talk about the state's response to the COVID-19 pandemic. And before I go to Senator Skinner to give us a briefing on not only the state budget, but the state's actions to address this public health emergency, I want to thank the Berkeley community for sheltering at home. It is working to flatten the curve and save lives. I've just been impressed by the dedication and care that you have shown, not just to your neighbors, but to your community. Whether it is organizing drives of personal protective equipment or donating meals to frontline medical staff, or donating to the Berkeley Relief Fund to support our small businesses and arts nonprofits and residential tenants, or helping the neediest who are also struggling at this time. I want to thank the Berkeley community for thinking about the needs of our entire community and also taking very seriously the public health directives that our health officer has given to stay at home and also to practice physical distancing. As we've touched upon in some of our prior town halls, we are at the phase where we are planning for what is next and how we're going to move to phase 2 and subsequent phases, looking at the guidance from the state of California, as well as the 5 indicators that our regional health officers have put forward, and thinking about how we're going to reopen our economy safely, not only for the employees, but also for our residents. And to that end, you may have read recently that I have put forward a proposal in partnership with Vice Mayor Sophie Hahn to explore the concept of outdoor dining, knowing that some of our restaurants are going to have a difficult time to be able to reopen and meet the state guidelines and ensure physical distancing. This is one of several initiatives the city is undertaking, which you'll soon hear about, to open up our streets for public use to maximize physical distancing. And I want to thank our city staff for working to develop a proposal that you will soon hear about, working with volunteers to allow open use of our streets for biking and walking, and also for exercise. It's important that we do so safely. So we know that Berkeley is facing significant budget challenges. As I've reported, we're facing a $28.5 million budget deficit. We also know the state is facing significant budgetary challenges as well due to the economic impacts of the COVID-19 pandemic. The governor has stated that there's a $54 billion deficit. And the governor recently released his May revise, and the state legislature is working very actively on not only the state budget, but also on a variety of bills to address the impacts of this emergency, from economic recovery to supporting our small businesses, dealing with rent and mortgage debt. And so we're so fortunate to be represented by an experienced, compassionate, and dedicated leader like Senator Nancy Skinner, who is fighting for us every single day. And so with that, I'd like to turn the floor over to Senator Skinner. And Senator, thank you so much for joining us today. And thank you for this opportunity to engage with the Berkeley community. And I know many residents are interested in hearing about the state budget and the work that you're engaged in to respond to this public health emergency.
Thanks, Mayor Arreguín. I want to thank you and council and city staff first for setting up the Berkeley Relief Fund, which I know is really very, very important relief for not only some of our small businesses, but some of our arts organizations and many of our residents who, as everyone, I think everyone has been very much impacted by this pandemic. And of course, those who've lost their jobs, that's been the most serious impacts. And of course, our many, many businesses, whether they're in the art space, the food space, or you name it, they have been seriously impacted. So I think all of us joining together, because it's none of us alone can provide the relief that is necessary for the level of financial impact that is so across the board being experienced. Fortunately, there are people who still are able to retain their jobs, and fortunately, most of our government workers so far have been able to retain their jobs. But of course, as time goes on and as we see the impact of the budget hits, we may even see furloughs, whether to state workers or to city workers, county workers, you name it. I hope that does not happen, but of course that is a possibility. Now, some of the questions that were sent that people were interested in, yes, the state budget, the governor has released just the other day, I think it was Thursday, what's called the May revise, which is his updated budget. And what a contrast. If you look at what was presented to us in January, the state had a significant reserve, not only a reserve, but we had a surplus of funding. And now we have this huge hole. The governor's proposal right now would be greatly relieved depending on congressional action. And I think most people have been following the news know that Speaker Pelosi and the House Democrats have approved a significant, what's called the HEROES Act, which would put some number of trillion dollars back into our economy, especially helping cities, local governments, helping states, and additionally helping individuals. And if that were to pass, so far, the Republicans have said they have no interest, but at least it's the beginning of negotiations. So we hope that there is significant action on the part of the federal government. And if that action provides the type of relief that I think many of us want for cities and states, then the cuts to the state and potentially even in Berkeley will be far less. But that remains to be seen. So right now we're looking at, unfortunately, significant cuts to education, our K through 12 schools, our higher ed, at a time when they really can't afford it, because in order to provide education during this pandemic period, there's more requirements on our school districts and on our campuses, whether they're going completely online or whether they have to, just the whole accommodation for making everyone safe in a pandemic. What I was happy to see is that the governor's budget did not have significant cuts to our housing, to what we were hoping to direct towards housing and homelessness. And the reason I was very happy to see that is because we have a concurrent crisis. We have the pandemic, the COVID-19 pandemic, but we also have an incredible housing crisis, as evidenced by the number of people that live on our streets. So we fortunately looks like we are not going to be taking money away from those pots of funds. So we hopefully can continue to deal with our homeless crisis, but also our housing crisis. And I know another question that people asked is, because so many people have been affected by either job loss or business income loss, they're having a hard time meeting their mortgages or their rents. And I think that you will see from the proposals from the state Senate, for example, and even from the governor, is a continuation of the moratorium on evictions and foreclosures. And then the state Senate has come up with a tax voucher idea where if landlords work with their tenants, the landlord would be able to get a tax voucher, and the tenant would have 10 years to pay their rent and or the rent that they have fallen behind on, or whatever negotiation they make with their landlord. And the benefit of that is, let's say we do start having a good economic recovery and you're able to start work again, say in January. When you look back, if you owe 6 months of rent, that is very hard to cover in a short period of time. So the reason that tool was designed to give 10 years is that most people, and again, there may be some who would not, but most people would be able to absorb the ability to pay over that period of time. So that is a proposal that the state Senate has put forward, and it will be, we will start to vet it. The very first budget committee, oversight committee on the governor's revise is Monday. I will be in the Capitol for that hearing. And then I am, in addition to being on the budget committee, I'm also the chair of the sub 5 committee. Sub 5 deals with public safety. And that hearing will be on Wednesday. And I will be in the Capitol for that also. I will chair that hearing. And there we will vet those proposals that the May revise has made for public safety. Now, the good news about that is that in times past, when we have faced terrible budget deficits, what we've seen is like a wholesale cut to rehabilitation programs or other programs that are very, very important for the kind of reforms that we have been trying to, that everyone in, I know that the residents of Berkeley have been advocates of, which is to give those who have been system impacted by our criminal justice system a fair shake and the ability to reenter successfully back to our neighborhoods. And I was very, very happy to see that the governor is not proposing wholesale cuts to our rehabilitation programs, but rather he's proposing things like shortening the time for parole to 2 years, which the evidence, the research over time has shown that that is really the useful time, that having the parole, what we call tail, having that parole around your neck for many more years than 2 years does not improve public safety and certainly does not improve the individual's ability to economically thrive within the community. So I was happy to see that the governor was willing to narrow parole to 2 years, and that also he has continuation of the closing of the contracted facilities, so the facilities that are not state-owned, that we had originally envisioned, and he's staying the course to close those. And he's also looking at how to give folks who are engaged in the rehabilitative programs more credits so that they might get an earlier chance at parole, which would reduce the population in our state prison facilities, which is very important from a budgetary point of view. So those are some of the things that were in that part of his May revise, and those will all be vetted next Wednesday at my public safety budget hearing. And the overview of what's in that May revise will be vetted Monday at the overall Senate Budget Committee. And those are available to watch online. So, certainly folks can look at those online. And then I think, let me see if there was one other question I want to address, and then I'll turn it back over to Mayor Arreguín. Let's see. The shelter-in-place order. So there, as was observed in the question that was submitted, is there has been a difference between the specifics in our Bay Area County shelter-in-place order. It's been more restrictive than what the governor has recommended statewide. But what we've seen now is that Contra Costa and Alameda County and most of the other Bay Area counties are starting to align their shelter-in-place order with the statewide order. The one county that is the exception is Santa Clara County. And if you remember, Santa Clara was really the core of where the outbreak first occurred and was most concentrated. And I think the Santa Clara Public Health Director is really trying to make sure that they don't see an increase in cases like you see in LA right now. But what the important thing to note is that our counties are what we have to follow. But right now, Alameda County and Contra Costa County, which is where most of us would either shop or do various of our business, not necessarily go to work, but do most of our business. Those two counties are aligning their order with the states, which opens up some more retail for curbside pickup and opens up some other parks and things like that. So that's the good news, but definitely you want to follow the Alameda County Public Health website and follow the specifics in that order. And with that, Mayor Arreguín, I'll turn it back to you.
Thank you so much, Senator Skinner, for joining us. Thank you for your leadership. I really appreciate you advocating for Berkeley and making sure that we get the resources that we need to address this public health emergency. So thank you so very much for participating today.
Yes, absolutely.
Thank you.
And any of the participants in this town hall, if you have further questions about either the state budget or state actions, you of course can go to my state Senate website and send my staff and I an email, and we will respond to you. So we've not had a town hall ourselves in a couple of weeks, but we will have one at some point soon to explain the budget and to explain any other changes that occur in the shelter in place. We just weren't ready yet to call it because we wanted to analyze the what's in the proposal first. but certainly questions specific to the state actions, please just go to my State Senate website and you can put your email request or question right in there. Okay, thanks.
Thank you. So I want to now transition to our City of Berkeley Health Officer, Dr. Lisa Hernandez. And Dr. Hernandez, can you give us an update on the number of cases in Berkeley as of today? Also, sort of along the lines of what Senator Skinner touched upon, I know that Alameda County recently announced that they're moving towards phase 2 and allowing some businesses to engage in curbside pickup. And is the City of Berkeley also looking at modifying its order? And any other information you would like to share with the Berkeley community today?
Sure. Good afternoon, everyone. I always appreciate having the time to speak to the community, and it's great to have so many esteemed co-presenters today and every week that we present. So I'll start with the California numbers and then drill down to the City of Berkeley. In terms of the confirmed cases for California State, we are now at 76,793 confirmed cases with 3,204 deaths. In Alameda County, there are 2,283 confirmed cases and 82 deaths. Those numbers do not include the City of Berkeley numbers. For City of Berkeley, we have 68 cases and 1 death. Those numbers have been stable. The last I reported to you last week in terms of the cases, we were at 66. So we basically got 2 cases reported to public health for the City of Berkeley this week, which is great news and kind of reinforces what we are seeing in the Bay Area and specifically Alameda County and City of Berkeley Public Health, which is the numbers of cases as well as hospitalizations remain stable and flat. And those are the 2 indicators, one of the two of the 5 indicators that we're looking at as we monitor shelter in place and the impacts of relaxations as we move forward. So I just wanted to point that out. Another indicator that we're looking at is the tests that are performed in our jurisdiction. So for the City of Berkeley, there have been 1,828 tests performed and reported to us on City of Berkeley residents. And the percent positive for those tests performed is 3.7%, and that's lowering as we go along over time, which is what we hope and expect as we do more tests. We have a better sense of who is positive, who's actually sick. In terms of the amount of tests that are being performed, in terms of a daily rate, we're seeing about 50 tests per day in the last 7 days performed on City of Berkeley residents, which is also an increase. And that's what we're looking at too, is we're seeing that we are having more expanded testing capacity within the city, not only by tests that are performed by City of Berkeley staff, but also providers in the community. We still aren't there yet. We need to reach at least 180 tests per day, but that's definitely an increase. And you can see the data on our website when you look at the dashboard data for tests as well as cases for the city. Talking about testing, we continue to have our test site that's available to test all symptomatic people who live and work in Berkeley. And we're continuing to have a wonderful response to that testing. Our nurse screening line continues to get numerous calls a day, and that number is 510-981-5380. Again, it's 510-981-5380, and it's bilingual, so English, Spanish speakers can call and questions are being answered. We're screening individuals who are symptomatic and we're getting them scheduled as soon as possible, usually with a same-day appointment. We are also proactively expanding our testing to vulnerable population groups. And we are testing, as reported before, we've tested residents and staff at one of our skilled nursing facilities. And we're starting to do testing at the other skilled nursing facilities one by one. We're also working with the facilities to make sure that they have the support and education to respond to individuals that may have COVID-19 if they're diagnosed. There's actually a requirement imposed by the state to have testing done regularly at skilled nursing facilities. So we're working with the facilities to ensure that they have that capacity. We're also assessing and testing homeless people in the community already, with working with our homeless outreach team and lifelong street medicine team, testing symptomatic individuals in the field and encampments. And we're beginning to test shelter staff at our test site, and we're hoping to roll that out mostly starting next week, and also testing individuals in the shelters. And that is for anyone who wants to have a test. So we're targeting on those vulnerable high-risk populations first. We're also expanding, as you've heard in my previous presentation, expanding our capacity, our public health workforce to do the case interviewing and the contact tracing that will come with the testing. These are all interrelated. We know that the way that we're going to battle COVID-19 and win the battle right now, because we don't have a vaccine, is to identify and isolate individuals who have the disease. So we need that workforce in order to help identify, interview individuals that are testing positive, and making sure that any of their contacts are aware so they can quarantine as well. So we've identified over 30 staff from 2 departments within our city staff, and they're getting contact tracing and case interviewing training starting next week. And we're also, and I just want to mention that this is something that we do all the time, this contact tracing and case interviewing. It's basically just at a larger scale because of the pandemic. And I just want to thank everyone, city staff, city leadership, and of course, the team in public health and communicable disease for working on ramping up these efforts. So I'll end with the shelter in place order. As mentioned, the Bay Area jurisdictions, the 7 of us health officers are looking at our data to see how we can move forward with relaxing some of the restrictions that are placed on us for shelter in place, and also looking at the governor's resilience roadmap. And we are aligning with the governor in terms of the release of the restrictions. We're just doing it a little slower. The governor looks at the whole state and looks at the indicators for the whole state. We are specifically looking at the impact of this disease on our Bay Area community. And we look different than some of the other parts of the state. So we are moving slowly. And fortunately, as reported earlier in my presentation, our numbers are looking pretty promising, and the data looks stable. And if the data looks stable for the next couple of days, we hope to move to the early part of phase 2 of the shelter in place restrictions, just like has been announced in other jurisdictions. So we continue as a 7 health officers to work together and to move as a Bay Area region. So we hope to open all curbside and delivery retail, and any associated manufacturing and logistics that support the retail. And also, just with that news, we want to make sure people are aware that curbside, you must make sure that people can walk past as you pick up whatever items you're picking up. We also want to make sure that you know that certain things don't change in terms of these relaxations. You will still have to social distance. You still have to wear a face covering when you're out in public. And the last thing I want to mention, people, I know is that there's a question on that today about activities. I'm going to, we'll be able to play tennis and pickleball. I had to figure out what pickleball was, but yes. that is something that we allow in singles. And the reason why that relaxation is occurring is because I've looked at the data from the other jurisdictions who have allowed it, and there hasn't been any increase in cases because of that activity. So I'll end my report there and wait for the questions.
Thank you so much, Dr. Hernandez. I'd like to turn it over to our City Manager, Dee Williams-Ridley, and thank you for joining us, Madam City Manager. And if you can provide us an update on city operations and the work of our city administration in responding to this emergency.
Thank you, Mr. Mayor, and thank you, Senator Skinner, for joining us. It's such a pleasure to see you. The three of us are usually on this panel, so it's really great to have you, and thank you for all of your service and all of your work. And Mr. Mayor, again, we really appreciate you executing and pulling us all together and making sure the community has time with, especially our health officer and with me. So I really appreciate your time and that of your staff and making sure that this happens. In terms of staff work, I want to give just a quick update on two areas. Number one, our outreach to our unhoused. I think it's important that I share that this has been one of the most central parts of our work in the EOC. It's pretty multifaceted. While creating housing solutions has been the biggest part of that work in terms of moving people from shelters and into hotels that are run by Alameda County, it's often hard to see the work that's on the ground. And that work has a huge impact as well. And I want to just give a sample from the last week of city outreach along with our partners, Lifelong, our HOT team from public health, our mental health team, and our staff across the city. So in terms of outreach, we visited 8 encampments, 2 of which were visited twice. During these visits, here are some of the things that happen. I think people like to know, what is it that you do when you're out speaking and talking and working with our unhoused community? So during just this week, we reached 135 homeless individuals. We provided over 86 masks. We distributed 66 hand sanitizers, gave out 98 bags of food, delivered 58 hot meals, and provided a few tents. Among the work they do is they also talk with people in the encampments to determine whether or not there are specific healthcare needs and that are specific to the pandemic. We identified people, the identified people referred to our partners at Lifelong Medical. That resulted in 34 people being assessed and 5 were tested for COVID-19. We continue to expand services that assist them as well in terms of showers. As some of you may know, our shower program was extended. The expansion of showers at Willard Pool and West Campus Pool has been a tremendous success. The average shower program numbers from May 5th to May 13th per day. Willard, 55 people per day, 84% of them, and I won't go into all of the demographics, but we're seeing huge numbers of people showing up and utilizing the services. To supplement this current shower program, Dignity on Wheels will begin its mobile shower program this weekend, starting on Sunday, May 17th at 2nd and Cedar Streets from 3 p.m. to 7 p.m. They'll go to Seabreeze on Wednesday, May 20th from 8 a.m. to 12 p.m. So when I think about the amount of work that's going out there, it's still not enough, but we are increasing, we're doing our best, and we're working harder to increase where we can. We've also increased contact tracing capacity. A critical part of our work is to increase our contact tracing capacity. As more activities are permitted, there is more movement, there will be more cases, more testing, and we'll need to do more follow-up in the form of contact tracing. It is a longstanding practice of the Berkeley Public Health's Communicable Disease Division and public health work around the globe, basically. But we identify cases, we test them, they trace contacts, and then identify who will need to be quarantined or isolated. What's different in a pandemic is the scale. We have 2 nurses currently doing contact tracing and investigations for the roughly 80 communicable diseases that are reported to us. Next week, we'll be training 34 staff members to participate in a UCSF hosted contact tracing training to learn best practices for COVID-19 positive clients. Staff trained, of course, for these roles they'll be activated as soon as we can on an as-needed basis to support our communicable disease unit and to support Dr. Hernandez. The second thing I wanted to go over is how we're doing in Berkeley and how we plan to move forward. And Mayor, I want to thank you and Vice Mayor Hahn, because one of the things that we're going to be looking forward to implementing is a Berkeley Smart reopening plan. And when I say SMART, SMART has a lot of acronyms, but for us, we're looking at SMART being specific, a specific plan for Berkeley, simply tailored. It's medically advised, so our decision making is about what we can do, what our data looks like, and making sure that our health officer is supported in the efforts and in the decisions that are being made. And then resilience. We want to be a resilient city. We have a full team in our planning department that is working on a long-term COVID-19 post-response to making sure that we're looking at resiliency and efforts and best practices to move us forward as a city and also to support our region. And then lastly, that what we're doing is time sensitive. We believe that the faster we respond in terms of making sure that we get to what people need, the better we will be in terms of serving the community. So one of the things that I forgot, and I hadn't had a chance to thank you, Senator Skinner, was for the work that you did in helping us with the sea breeze and with the entire Gilman corridor. And we've seen a tremendous cleanup and difference on a corridor. Thank you for working with us with Caltrans and making sure that that cleanup happened. It just keeps us safer and keeps a cleaner city. So those are my comments for the opening remarks, Mayor, and I'll look forward to your questions as we move forward. Thank you.
Okay, thank you very much, Madam City Manager, and thank you for your leadership and all the work of our city staff who are really working around the clock, including our first responders, our public health staff. We activated the EOC in January and have really ramped up operations in March and have been working over the past several months to deal with this public health emergency. And I think it's really making an impact, and we need to keep the work going and keep continuing to follow the guidance that our public health officer and public health staff have put forward to shelter at home and practice social distancing. So we received a number of questions, and I'm going to go first to you, Madam City Manager, for a few questions around city operations. So the first question is around our camps. So in a previous town hall, it was mentioned that guidelines on summer camps will be released in mid-May. Are there any updates on our camps or guidelines on the administration of our camps?
Yes, so in terms of our camp guidance, and I'm going to look at some of my notes here, we should have it ready next week. We did announce that it would be very close to the 17th. We should have that guidance ready next week. Right now, we're keeping the childcare camps, et cetera, focused on children who can return, focused on children whose parents need to return to work. Of course, that will hopefully expand this Tuesday. We specifically asked the state about libraries, and that's another question that's listed there. But our library staff are being deployed to support operations within the city around testing, around working in a SHARE program and different services. Right now, our camp guidance is expected, I would say mid next week.
Okay, thank you very much. Related question is around childcare. I know it's something that residents have asked about in the past. And this resident acknowledged that there was a real significant shortage of childcare available even prior to the shelter-in-place order, and was interested in the City of Berkeley's efforts on supporting families with young children and what childcare opportunities are available in the city during this period.
So in terms of childcare opportunities right now, clearly the childcare facilities that we're getting ready to uplift is through our Parks and Recreation program. Those are mostly going to be camps. We don't, and this is one of the areas where I think we lack the most supportive services for our community, and there needs to be a lot more work done to help in this arena. I know that Alameda County has been working on different goals and efforts, and so we'll continue to work with them and to understand what their plans are in terms of helping to support the entire county, because this will certainly need to be a huge countywide effort to move something forward. In terms of, private camps and private schools for those programs, and Dr. Hernandez will be able to help out here too in terms of what's allowed right now for child care facilities that are privately owned. But at this time, we are looking to open up a few, minor support areas around camps for the summer. And I believe we'll have 240 spots available, and those will be dedicated and available to parents who are essential service workers that are having to actually go to work and be deployed right now.
Thank you very much. Next question we received is about our libraries. This resident was curious about the status of reopening our libraries, and I think a lot of that's going to be really dependent on not only the state, but also regional indicators and how we're meeting those indicators.
So as I said, so two things, our staff are being deployed from the libraries to different pandemic response and needed work that's happening across the city. We did reach out to the state about libraries, and unfortunately, they're not allowing libraries in this stage to open in any form yet. We've had questions about having the tool program reopen, and as I shared in our last session, that those are high surface type areas and high shared equipment. So people touch and share equipment, and it's part of the program. So none of the library services have been allowed to reopen at this time. I do know that if you visit the library's website, they are, working through online types of resources. So folks should at least go on the website to see what is still available and what kind of services that are online that they are supporting the community with. But at this time, unfortunately, we don't have any date certain on when libraries will reopen or any services that are directly provided to citizens.
Thank you. Next question is about slow streets, which is something that we've talked about in the past and gotten a lot of questions about. And this particular question is asking the status of implementing closed streets in the city of Berkeley for greater social distancing.
Thank you. Thank you, Mr. Mayor. And yes, this has been the biggest question of all. And I think I want you to be excited because I'm excited. We're looking to launch a Healthy Streets program on May 21st. So you should hear more information about the when, the hows, the wheres. What this program will do, though, it will require a huge volunteer effort across the city to help implement this. And I want to thank Bike Walk Berkeley for their support and their interest in helping us to lift something up for our city. As you know, we've already been a city that's been innovative in this arena in the past. So this is not new to Berkeley, but this should be expanded for Berkeley. So we're very excited to announce it on the 21st of May. So thank you very much. And for the folks that are out there that put the pressure on, thank you.
So please stay tuned for information about the launch of that program and also what streets specifically are going to be closed. So thank you. And I want to also elevate the partnership with Walk Bike Berkeley and community volunteers will really be essential in the implementation of this program. So thank you to everyone who's going to be working with the city to make this happen. So my last question was around the homeless. You touched upon this in your opening comments, but there was a very specific question on the number of positive cases of homeless individuals in the city of Berkeley at this time. And I don't know if you have the answer, Dr. Hernandez, but we've had a pretty low rate of positive cases of people experiencing homelessness.
That's correct. And I'll defer to Dr. Hernandez to answer that question, but we've had a very low rate. And so go ahead, Dr. Hernandez.
Thank you.
Well, yes, exactly. I believe there might have been 2 cases in the 68 cases that have been reported to us, and that was reported several weeks ago. So we haven't had any additional cases, which is great news. Again, that's one of our groups that we are focusing on in terms of doing broader testing, whether they're symptomatic or not, as reported earlier by both City Manager, sorry, and myself, is that we are doing testing already in the communities for symptomatic individuals, but we're also now expanding to doing what is called targeted surveillance testing, which is testing anyone who wants to be tested in certain high-risk populations. I hope to expand that to more people, but right now we're focusing especially on those high-risk populations.
Thank you. I know that we're doing a number of things, albeit there's always more that we can do. And I think resources are always a challenge, especially in this period of time. And not just financial resources, but just places for people to safely shelter. But we are engaged in a number of initiatives, such as moving people, particularly people with high medical needs, into trailers, looking at expanding shelter. We are still referring people to the hotels in Oakland, continuing to look for hotels in Berkeley. And then moreover, you are seeing a lot of people who are living in tents on the street. And while that does raise concern for some people in our community and some businesses, the CDC's guidance is that it's actually better for people to shelter in place than to remove and disrupt tent encampments. And so our staff have been going out there and telling people to be clean and to be respectful, knowing that they are occupying public spaces, and also ensuring that people are behaving in a manner that is safe. But please know that while you are seeing more people living in tents, it's because that is the safer thing to do. While the goal is to get people out of tents and into hotel rooms and other sheltering opportunities, and that will always be the priority, at least for now. That is something that you're going to see more likely throughout our city. But that does not mean that we're not continuing to find other opportunities for people to shelter safely off the street and out of the elements. So that continues to be a concern. I'm very glad that the state did not substantially reduce those resources, but it's all the more reason why the HEROES Act that has been put forward and was passed by the House yesterday is so essential. And it's going to go to the Senate. There'll be budget compromises, but the city will stand to get millions of dollars in revenues if the bill is signed into law this year and next year. And that will not only help us address our operating deficit, but could provide us more resources to do the testing and to do the outreach and to provide, to buy hotel rooms or lease hotels to provide safe shelter for people. So on my soapbox, I am encouraging residents of Berkeley to please contact your senator and the Senate to urge swift passage of the HEROES Act. So those are all the questions for the city manager. Thank you, Madam City Manager. I'm going to go to the public health officer for a few questions, some of which you may have already addressed in your opening comments. You talked about tennis, so thank you. There was a question with regard to if a occupant of a multi-person household, specifically tenants who are living in multi-unit housing, pass away or contract COVID-19, are we informing those other occupants that that individual has passed away or has contracted COVID-19?
So I'm sorry, I had to talk about tennis before the questions came up. That was another one that I was happy to be able to share the news as soon as possible.
Thank you.
in terms of the questions about notification of if an individual dies of COVID-19 or individual dies who has COVID-19 and the notification that occurs, notification will occur just as we would if someone with COVID-19 has exposed individuals, whether they are living or not, in terms of the risk, because the risk of exposure exist. So that's when we would notify if there's a risk of exposure and you're identified as a contact, or if we can't notify everyone because we don't have enough information or because there's been a mass exposure. And I've used the same example before about this question. It's what we do for every infectious disease, that we need to identify contacts that we can't do so one-on-one. So with the measles, we made that notification and we issued a press release for it, and that happens sometimes. We haven't had that to issue that release for an exposure for COVID-19, but that's what we would do.
Okay, thank you very much. Next question is around, I'll kind of combine them. It's around testing. Is there a timeline when testing will be available for all Berkeley residents? But kind of a related question, and I think this kind of answers the question, is what are the challenges to expanding testing in terms of sort of supplies, swabs, staffing, lab capacity? I would imagine that is the challenge to expanding access to testing, is the availability of the supplies and to process the tests.
So I'll answer it yes, and it's actually, I could answer it in two ways. One is my hope is that we expand testing to that everyone who wants to get tested for COVID-19 can get tested. And actually, that's the recommendation that I've made to providers in the community. We issued a health alert earlier this week, and there are still priority individuals that should be tested because of their risk, whether it's medical risk or being in a congregate setting or being a worker in specific industries such as healthcare. So those are the priority groups to be tested, whether they're symptomatic or asymptomatic. Of course, anyone that's symptomatic should be tested. And then the last priority, the last second group of people to be tested is anyone who can be tested. For providers in the community, their barrier seems to be access to swabs. Or to the reagents that need to hold the swab so they can be tested. So that's the biggest barrier that I've heard in the community for providers, is that there isn't enough swabs or test kits available. So I'm hoping that we're going to get more availability as days go by. As you saw, our numbers are going up, and some of that is due to providers in the community. Some of it's because of the testing that we're doing at our test site. So when we look at our test site, what are the barriers there? Mostly resources is a good bucket. One is funding, some money. We've talked about how the budget is constrained, but we're looking for opportunities to be able to increase capacity in that way. And the other is staffing. And we have had a number of people wanting to volunteer, which I truly appreciate. But what I need, and this is a plea today and an ongoing plea, is that if you are medically trained and licensed, sign up to swab. We need swabbers. We have case investigators, which is great. We may need more of those too. So don't not sign up if you can only do case interviews, but we really, really, really need people who can swab. That's something that that has to be done by someone who's medically trained, someone who has a license, paramedics, physicians, nurse practitioners, nurses, those individuals, dentists, those individuals can swab, and that's what we need. So we need specialized help So that's one of our barriers to that. But my plan is to offer it. As I mentioned, we're doing targeted surveillance, so testing for those that are in highest risk, and we're slowly ramping up, and we hope to have more as our capacity increases.
Excellent. Before I answer the last set of questions, if you can once again provide that number, the
Sure.
triage line, that'd be great.
I have it tattooed here now because I forgot it like 2 weeks ago. So it's 510-981-5380. I'll repeat it one more time, 510-981-5380.
And that's the number to call if you are symptomatic and would like to get tested by the city.
Yes, yes. And if you happen to be a worker in a shelter, that's another reason, whether you're symptomatic or not, you can get tested as well through our line. So that's starting Monday, actually Tuesday, because Monday is a city holiday. So Tuesday, that number will accept shelter workers that serve Berkeley, as well as anyone who's symptomatic who lives and works in Berkeley.
Excellent. Thank you so much. So I'm going to address the last set of questions, a lot of them related to the proposal that Vice Mayor Hahn and I introduced this week around open air dining. And I just want to reiterate that this is a proposal. The City Council has yet to take action on it, but this will be coming to the City Council on June 2nd. And if the council does refer this to the city manager, we will be working with the city administration. And I also recommend, and it is specifically called out in the item, that we do solicit the input of our business community around what would be appropriate locations, streets, and other public spaces to implement this program. I've already gotten a lot of recommendations on possible streets or locations to close. And in fact, one of the questions was, how can we suggest areas to be used for outdoor space dining? I think that's something we'll have to consider. We may want to consider a Berkeley Considers online survey to get input. So please stay tuned on that information. But there's a lot of specifics that have to be worked out. What areas will be closed, when, how do we close them safely? There were questions around how we may address issues around people experiencing homelessness who may also be congregating in the area and may not be following public health guidance. That's always an issue, whether you're unhoused or not. We have people that are not, unfortunately, following the public health guidance, and are not wearing face coverings, and are not taking necessary precautions to physically distance from people. So that's an issue regardless of who you are, regardless of your background. How are we going to ensure that people are physically distancing safely while they are outside? Whether you're sitting at a dining table with chairs with your family, or whether you're walking down the sidewalk or going to a park. So those are always ongoing issues that we need to address. And then in addition, we'll be providing tables and chairs to assist restaurants in the implementation. And once again, those are issues that we'd have to consider. Once again, as I mentioned previously, the city is facing a $28.5 million budget deficit. So we are really resource constrained this year, but perhaps there may be opportunities in partnership with the private sector to look at ways to implement that. So these are all excellent questions and things we'll take into consideration as this proposal moves to the City Council. And I think just indicate some of the things that we have to think about. But I think it's an exciting idea. Just like the idea of closing streets for residents to be able to walk safely, to bike, to run, to get some exercise, I think it's an extension of that. And similarly, part of kind of a long tradition of Berkeley to close streets to calm traffic, and something to consider. And then I know that other jurisdictions in the Bay Area are considering as well. So please stay tuned. These are all excellent questions. All these details will be addressed if this proposal is voted on by the City Council and moves forward to the city manager. There was a question about what the university is going to do in the fall. And that's an excellent question. the university has yet to make a decision about whether they're going to have in-person instruction, online instruction, a hybrid, where we see news reports of some universities that are doing all virtual classes, some that are allowing students to come back. I met with Chancellor Carol Christ this Monday to not only update the Chancellor on the work the city of Berkeley is engaged in, but also to try to get some idea about what the university's plans are. And they have not yet made a decision. The campus has launched several internal task forces that are looking at a variety of issues, testing, a variety of different things. But what does appear to be the case is that there may be a hybrid where the campus is allowing some in-person instruction for certain classes and also some virtual instruction. We know that that's going to have an impact on our business community, because the many thousands of students that live in our city, they contribute to our local tax base. So I'm concerned about that from an economic perspective, but at the same time, the university has to be able to reopen safely. And so no decisions have been made yet, but the chancellor has given an indication in public remarks that some hybrid of virtual and in-person instruction may likely be the case, at least for the time being. And today would have been graduation day for UC Berkeley students. And in fact, there's actually a virtual graduation that's happening today. And I just want to congratulate all the graduates of the class of 2020. These are really challenging times to graduate. It's unfortunate that you're not able to graduate in person, but know that your hard work has really paid off, and that you join a proud tradition of Berkeley graduates who are really making a difference in this world. And now more than ever, we need the leadership of the best and brightest to address the challenges of our day. So please stay tuned for information about what's going to happen with the campus. The campus will be making a public announcement this month. And then lastly, with regard to rent increases, there was a question about the rent board's emergency regulation, which allows landlords voluntarily to reduce rent, and which would not modify the rent ceiling. And has there been any new regulation on new leases to allow lowering of rent during the pandemic? Unfortunately, the state law prohibits local governments from being able to limit rent increases upon vacancy. So when a new lease is entered into, the landlord can raise the rent to whatever the market will bear under the Costa-Hawkins Rental Housing Act. But please know there's a whole suite of regulations in the city of Berkeley that some are ongoing regulations, some are special regulations that we put in place to respond to this emergency, including a moratorium on evictions for non-payment of rent. And there's a proposal actually coming to the city council in a couple of weeks to broaden that for all evictions. But at the present time, if you cannot pay your rent, and you've been impacted by COVID-19, you've contracted COVID-19, you've lost your job, you've seen a reduction in income, under the emergency regulations the city council adopted in March, residential and commercial tenants cannot be evicted during the local state of emergency. And Senator Skinner talked about the fact the state is looking at expanding those state regulations beyond the state of emergency, which is actually going to be essential. That is in addition to our housing retention program, which the city of Berkeley has launched. If you are a tenant who's been impacted by COVID-19, you cannot pay your rent, please call the East Bay Community Law Center at 510-548-4040. 510-548-4040. The city has launched a program to provide cash assistance of up to $10,000, which could cover multiple months of rent. And we're actually moving forward. And I want to thank the city manager and the staff in Health, Housing, and Community Services for getting those first round of grants out there, which is actually going to help people address their rent debt and make sure that they are not going to face eviction after the state of emergency occurs. So this is an area that there's a lot of work that needs to happen, because when people go back to work, or if they can't go back to work, what's going to happen? How are they going to pay $6,000 to $10,000 worth of debt on top of their rent, knowing that rents in Berkeley are already very high. But we are seeing a downward impact on the market where rents are actually going down slightly. There is a great number of vacancies right now in the Berkeley rental housing market. And I do expect that that trend is going to continue. So those are my responses to all the questions. As we close, I want to update everyone on a really exciting announcement. As of yesterday, the Berkeley Relief Fund has raised over $1 million. And that is a testament to this community. Some people have given $5, some people have given $50,000. Bayer Pharmaceuticals gave the largest contribution of $250,000. And I want to thank Bayer for their very generous contribution and their ongoing partnership with the city of Berkeley. We are working to get to $1.5 million and beyond potentially by May 31st. And so next Sunday, May 24th at 2 p.m., the Berkeley Symphony is going to have a special online program specifically to focus on the Berkeley Relief Fund and to support the Berkeley Relief Fund. But they'll be playing a lot of incredible music that has been recorded at some of their concerts over the past year. So please stay tuned for information about how to watch that program. You know, we need a little art and entertainment to get through the day and stay sane. And please continue to give to the Berkeley Relief Fund at berkeleyrelieffund.org. We are going to be discussing how to move forward with the next round of grants to support our small businesses and residential tenants. The need is immense. We had over 1,000 applications. We were sadly only able to help about 350 businesses. The number of tenants who call in to the East Bay Community Law Center asking for assistance is overwhelming. We can't keep up with the need. And so this is just one step of the city is taking on its own, even in a very impacted budgetary situation, to address the needs of our small businesses, our nonprofits, and our community. But we hope that more resources will be coming from the federal government to even enhance the support that we can provide to our businesses and our residents. So with that, those are all the questions. I want to thank Senator Skinner for joining us today. Thank you, Dr. Hernandez, for also participating, and the city manager. I know your schedules are very busy, but we're so fortunate to have you serving our community at this time, to have such dedicated, brilliant, exceptional leaders who are really making an impact. And we would not be where we are if it wasn't for your leadership. So thank you. Really appreciate you being part of this today. Give you the opportunity to make any closing comments if you would like.
Just very quickly, just want to thank the community. This has been a long, long ride for all of us, and we are making a difference. And thank you, Mayor, and the amazing council that you lead in our city. The ideas and the innovation that's being put forth is it's just amazing. And my leadership team that supports me in every way possible, they make it happen every day, and I'm very, very grateful to their work and their leadership. Just yesterday, we launched a groundbreaking virtual ceremony for Tuolumne Camp, and over 200 participants. Our community has supported this effort along with our council in making sure that the rebuild of Tuolumne Camp will happen. Groundbreaking is taking place I believe in May. So we're just excited to have some morsel of excitement to keep us moving along and as we shelter in place. So thank you, Dr. Hernandez, and very glad to see the Senator. So thank you, Mr. Mayor, and I'll turn it back over to you.
Thank you. Dr. Hernandez, anything you'd like to say before we jump off?
Sure. Just quickly, I want to thank the community for abiding by the shelter-in-place restrictions, especially the face coverings. That's a big one that I know it might have been difficult for people to do, but we truly do need people to continue to socially distance, especially the 6 feet when you're close to people, as well as wearing the facial coverings. Those things will not change as we move forward with the releasing the restrictions of shelter-in-place, and it allows us to do it, because we're seeing those efforts are required for us to continue to keep safe as we move forward through this pandemic. And it's actually a marathon. I'm not a runner, but but we all are participating in this marathon, and I appreciate the support from the community, from city leadership, in particular, Madam City Manager, and of course you, Mayor Arreguín, and the community and the leadership from the state as well. So in my end, only want to say thank you.
Thank you, Dr. Hernandez. So last thing I forgot to mention, this is Berkeley Dine at Home Week, I think is the name, where even though you can't go support your local restaurants, we have so many amazing restaurants in our community, world-class cuisine, who are really struggling at this time. But many of them are open for delivery or for pickup. And so Visit Berkeley is launched a Berkeley Dine at Home Week, starting this weekend to next week. And so please take this week as an opportunity to support the many local restaurants, or to try restaurants you haven't even heard of, many of whom are providing delivery or pickup service. So go to visitberkeley.com for information on participating restaurants. And with that, Berkeley, have a wonderful day. Please stay healthy and safe, and we'll see you next week. Thank you.